Dear audience, welcome to the show POWERchat. In today's episode, we'll be discussing about the awareness on retinoblastoma, the disease on eye, also known as a cancer on eye. Joining us today are two important special guests from Germany, Mr. Gregor Konig, founder president, and Ms. Monika Konig, head of trustee at the KinderAugenKrebsStiftung, also known as German Children's Eye Cancer Foundation campaign. Please allow me to welcome them. Welcome to the show.
Thank you very much.
How have you been, Mr. Konig and Ms. Konig?
Here in Nepal, we always feel very welcome, and we like the people. We like Kathmandu, and we feel very welcome.
You are a journalist by profession, and you are a lawyer by profession, and currently you are engaged in a global campaign creating awareness on retinoblastoma. Could you tell us what made you engage in this global campaign?
It might sound a little strange that we entered into this campaign with those professions, but our fate actually is what made us tackle this this idea. In fact, our youngest daughter, at the age of 1, was diagnosed with this eye cancer, with this retinoblastoma. And after we had gone through a lot of terrible experiences and some rest, we decided we need to change the situation. And so we started in Germany and then extended later on to other countries.
Mr. Konig, you mean that the disease that your daughter has gone through was diagnosed a bit later?
Exactly.
Because of the lack of knowledge?
Exactly. That is the point that made us think about starting a campaign and a foundation, because we saw that this type of cancer is easily recognizable even for parents, but we also saw that ourselves did not recognize this cancer for 4 months in our own daughter. So we had pictures of our daughter with a white spot in the eye in our photo albums, and we did not realize that this was a lethal danger, a fatal risk. And only after 4 months, by coincidence, a friend that was an orthoptist told us, you really need to go see an eye doctor quickly. And then we got the diagnosis cancer. The doctors told us that 1 or 2 weeks later it would have been too late, because then the cancer would have entered the brain.
Well, Ms. Konig, you are a practicing journalist. Could you tell us what made you engage in this campaign in line with the importance of information in such campaigns?
Well, the thing was, actually, when we found out that our daughter had cancer in the eye, I went back to my TV station where I work, and there are hundreds of people working, and I asked them, did you know that a white spot in the eye means a very dangerous eye cancer in children? And nobody in the TV station, no one, had ever heard of that. So we thought, with my husband being in the medical field and me being a journalist, we have to use our sources to make this white pupil known to young parents and even pediatricians who don't know the disease. So maybe I can show what it looks like if you have retinoblastoma in your child. It actually looks like that. It looks like it's an artificial picture, but it's not. That's what it looks like if your child.
It looks like a white spot.
It looks like a white spot, and actually what you see is the tumor. The white eye is the tumor that you see in the back of the eye. So actually we started that campaign, and with the help of many friends, colleagues too, we got the campaign started, and in Germany we were able to much later establish a pediatric eye screening for children at the age of 6 months, and now a lot of most retinoblastoma patients are caught very early, and we can treat them in a way that is very good for the children, and we can save eyes, we can save lives. And in Germany we have a rate of more than 90% that we cure. In Nepal, it's still a very lethal disease, and we want to change that for the Nepalese children as well, because we want them to lead a happy life as our daughter is now able to do.
How is your daughter now, and do you have any message from your daughter to the children of Nepal suffering the same kind of disease, or they are subject to suffer this disease due to lack of information?
Well, the first thing is that our daughter is going to school just like any other child. She has a glass eye, but you can't really tell. It was a very good work from the man who does the glass eyes, and she's leading a very normal life. And she's a very special, a very happy child. And I think it's strange that we're here now, and it was our child who sent us on this journey to Nepal. I mean, this is. So I think she would be happy to meet children her age with the same disease in Nepal, and I think they would be really good friends, and there is a very good life that you can lead even if you had this kind of very bad cancer when you were very young.
Well, Mr. Konig, could you tell us more about the campaign See the Light? How do you work with the institutions or hospitals or any stakeholders or partners across the world, since it is a global campaign?
Yeah, exactly. So we realized that actually when we started in the year 2009, we were in an era where there was already an existing global network on the digital level, and we thought that if we make use of this network, of all the opportunities that you have with YouTube and Facebook and all those things, if we focus on that, we can achieve a lot with very little funds, because obviously we didn't have much funds in the beginning, and we realized that very quickly we were able to spread the news. And this is probably something to do with the fact that cancer is so easily visible, because our concept was that in principle you don't really have to know the exact disease. You just, as a parent or as a doctor or as a relative, you just have to see this image once and then store in the back of your head, this is something dangerous. And whenever you would see a picture or photograph taken by anyone in your family or a friend, if you see the own child or their child with a white spot, you will remember, this is dangerous, so let's go to an eye doctor. And then we've achieved what we need to achieve, because the rest will be done by the specialists. And this concept worked very well in Germany, and that's actually the point where we decided we have to extend to more to countries where there's a strong need. Obviously you have some campaigns in the US and other countries, but for the developing countries there was not much being done. And the fact that this is a cancer that can be cured in Germany with 95% success rate, 95% of the children survive and lead a happy life, and in many developing countries you're as low as 10%, so 90% die. But it's not a big thing to change that, because we don't need a very complicated diagnostic, and we also don't need a complicated treatment, because if you identify the disease early, you can actually, it sounds cruel, but you can just take out the eye, and you take out the cancer with the eye, and basically you've solved the problem in most of the cases.
At which point or at which level it can be diagnosed? Could you tell us about this, Ms. Konig?
It's very different. The tumor grows very differently in the different children. So some kids can be diagnosed at a very early stage, with a few days old. I think the average diagnosis for a bilateral retinoblastoma, which is in both eyes, is 1 year, and for the unilateral, if you have the cancer in just one eye, it's 2 years.
And what about the readily and easily available information about this particular disease, retinoblastoma or white spot or cancer on eye? Do you think that children suffering with this disease at the global level or in the countries that you are working, partnering, the information is readily and easily available so that people are aware about this disease? Could you tell us more?
I don't think so. It wasn't the case in Germany when we first started. It has changed now, and it's not the case in Nepal, as far as I know. And that's what the people in the hospitals tell us here, that people are not aware of the disease. So we're very thankful for this opportunity to tell people to watch out in little children for the white eye. And I also think that we will have to use outreach camps and community eye centers. We have to reach them and tell them about our campaign, and then they will be able to distribute the information all the way to the small villages. Nepal is very different from Germany. In Germany it's easy to reach everybody, so it was quite interesting for us to learn how things work here and how we actually reach the last corner of this country. But I think we're working on it, and you have a very good network already that we will use to disseminate this information.
What is your impression about these works or this initiative? You are partnering with different organizations here in Nepal, including at the hospitals.
Yeah, so we're actually very happy to experience that there's already an existing structure here on different levels that we think we can actually access and hope to access. So you have a very well developed cataract campaign, and that goes into all kinds of remote areas for eye treatment. So this is something where already doctors are in contact with remote areas. Then there are vaccination programs, and one of the driving examples for us was that in Honduras, for example, they started a campaign where they used this kind of information material, just added it to this, the vaccination teams that went all over the country. They did nothing more than give the patients that were vaccinated these little pictures, and they dramatically reduced the death rate for the children. So going back to Nepal specifically, we have seen these structures, but we realized we need to have a high quality and specialized treatment, because it's no use diagnosing but then not having anyone that can treat the disease, especially for the complicated cases. I said that previously that in many cases you can just take out the eye. This is certainly something that a normal ophthalmologist or even doctor with a little bit of training can do. But for the more complicated cases, obviously you need somebody that would be experienced in the retinoblastoma field. And this is why actually our first step in our access to developing countries was to set up a fellowship program. And the fellowship program sets the foundation for the expertise at the respective hospital, and there the first hospital we chose was Tilganga Hospital in Kathmandu.
Who do you target within the fellowship programs? Are they the medical practitioners, doctors, or anyone?
Yeah, so the fellowship program is basically a program that is open for anyone to apply. Then they go through a selection process. We get to see their documents, their history, and we also get to see their goals. And then we decide whether the doctor is a good choice for our program, because we need to be sure that they take don't see it as a holiday or something, but take the specialization serious and come back to their country and really have the urge to change something. And this was, for example, with Dr. Ponima exactly the case. And she came back and started treating the first retinoblastoma patients here in Kathmandu. And now the next step then was to provide the devices, the equipment that you need for high quality treatment. And this is actually what we did in the last 2 years, that we generated the equipment, because coincidentally most of the companies are German that produce the ophthalmology equipment, the high quality things. So we established contacts with these companies and convinced them for our cause. So they gave us most of the devices for free, and we could bring them to Nepal and provide them with the clinic.
Well, Ms. Konig, could you tell us about the role of doctors who participate in the fellowships and go back to their countries, not only in the case of Nepal? How can they play an effective role creating awareness about this disease?
Well, I would like to come back to Dr. Ponima from the Tilganga Eye Hospital. She spent 1 year abroad. She was in the US and she was in India with a fellowship to learn about treatment of retinoblastoma. So she really did a big effort, and she was away from her family for a whole year to really learn how to treat retinoblastoma children here in Nepal. And I think she did a wonderful job, because she learned everything, and now she's back here, and she did not only learn how to treat retinoblastoma, but she developed a passion for this disease and for the children, because it's very special children. You know, they are born with this disease, and they can't do anything about it. I mean, they didn't smoke and get lung cancer later in their lives, but they are born with this cancer. And I think Dr. Purnima is a very especially dedicated person, and she's also a member of the Nepal Cancer Relief Society. They have awareness programs for early detection of cancer, and also for how to prevent cancer. And she wants to include the Nepal Cancer Relief Society into creating awareness for retinoblastoma. And so what you really need is a passionate doctor in the country, and we found one. So that is really wonderful, and we have a lot of trust in her that when we go back to Germany, this will still be her big aim to do something for retinoblastoma, and we're sure she will do that.
Well,
maybe let me
yeah, please.
add something also for the global level. So we also entered a little later. We entered the same program and experience in Bangladesh, and we have also there found Dr. Soma with the same kind of dedication that is also setting up the same kind of clinic. So actually what our plan is to establish a kind of role model, so that at a certain point we can say, if you want to tackle this disease in a developing country, this is what you have to do. First step this, second step this, avoid doing this, this can be a problem, this is access to information, and so on. And once we have established this, maybe with 2 or 3 countries, we think then we can actually export this to other countries, and even because our resources at some point will be exhausted, that we think we can get other foundations, national foundations, just to use this template for their country, because the principle is so easy. Visual, information, equipment, and expertise, and it's no big thing. So that's the global plan.
Well, it's really impressive that this disease can be cured, and if diagnosed on time, you told that 90 or 95% of the cases in Germany were actually treated. But here in Nepal or the developing world, it's not only about lack of information, but in many cases of the disease age, people have problem affording the treatment. Could you tell us how affordable is this?
So our experience is that it seems that in the developing countries that we have seen, and including Nepal, at the level of treatment, actually there seems to be a system where, at least for children, there's some cross-subsidization with other patients. Some patients pay, some don't, some pay a minor amount, some pay a larger amount. The doctors seem to be willing also to go certain lengths to treat children that do not have the funds, so that we think a major part of the problem is actually getting to the point where you're in the specialized hospital. So that's where the funds are lacking, maybe for travel, for the first diagnosis, and so on. So part of our programs are also providing funds for those families. This is a program that we specifically, how we started in Bangladesh actually, where we provide the funds for the chemotherapy, because the families simply don't have anything. We understand that in Nepal there's a campaign developing where the government intends to support cancer patients or children with a certain amount, so that would be taking care of the treatment. And then we have also, and this is a major part of our visit this time, engaged the Rotary clubs, where we will be attempting to get a so-called global grant, where Rotary International picks up a large portion of the funds that we consider necessary, and that will give us a lot of freedom to operate on that level.
What do you have to say?
As my husband said, I would say that I think it's terrible if you say affordability of a disease. That sounds terrible. It's like, it sounds like you buy something, can you afford it or can't you afford it? This is something, there's no question if you can afford it. You just get the disease and then you have to try to deal with it. And I think the most important thing is that parents learn that it can be cured. And then I think that as far as we hear from the doctors, there's always a way to make the disease affordable in Nepal. It might not be very easy, but I think that as what we hear from Tilganga, they are trying to get the official admission for treating cancer, and that way they will get extra funds for treating kids that have cancer. And I think, as far as we know, they are getting this admission within the next few months, and then I think it's an affordable disease.
Well, I was referring to the cases that in the case of chemotherapy, not only that of the eye cancer, but in cancer in general in Nepal. What we have seen here in Nepal, that there are many cases with the hospitals where patients could not afford the fee. And there are organizations like yours supporting them.
Yeah.
So it's not only about the information, but the affordability of the disease, and curing about this disease.
Exactly.
You guys are really doing a wonderful job on this.
Thank you.
And could you tell us, the countries like Nepal, what should be done identifying this disease, diagnosing this disease, so that there is more awareness about the disease called retinoblastoma? Could you tell us?
Yeah, I would say there are different opportunities that you could use. So I would say that having a specialized center, or maybe even more specialized centers, is the first thing. Then you have to disseminate the information to the community centers, and there are lots of community centers that you have to disseminate the information to. You have to inform medical staff, not only doctors. You have in Nepal you have a lot of medical staff that is very well educated. So they have to be trained. You have to train on the level of early detection with the Nepalese Cancer Relief Society. So I think it's a way. And also, I mean, giving us the opportunity here now to talk about this disease and the early signs of this disease is very important. So the media would play a big role in that as well, I would say.
Maybe it is a more technical or medical question. Could you tell us, since you are engaged in this campaign, the reasons behind this particular disease that can be, identified or diagnosed within the family?
Yeah, so the disease is a very special disease because on the one hand, it does not distinguish much between societies, ethnical background or anything. It's basically a certain percentage worldwide, where with a little exception that there's a higher percentage in very, let's say, closed communities, and coincidentally one of these closed communities is in northern India, southern Nepal, where there's a kind of small genetic pool, so there's a higher incidence. But what happens is that actually before birth there's a spontaneous mutation, which means that the cancer cell is in the majority of cases not a result of something in the parents on the genetic level, so it's not heredited, but it's a spontaneous change in the cells developing when the embryo is developing. So actually, usually you will find a child where you diagnose after birth or after 1 year or 2 years, when the cancer develops from one single cell in the eye. You will not find that the parents or siblings have the same disease. But once you have this disease, if you do get offspring, 50% chance that they will have the disease, because unless you marry a affected person as well, so you can inherit it. But as I said, it's usually a spontaneous disease, and then the tumor grows from that mutation.
Well, Mr. Gregor Konig and Ms. Monika Konig, There are many interesting issues, but we are coming to the end of the show. Finally, both of you, do you have anything to tell to our audience very briefly?
Yeah. So our mission and our message to the audience is that diseases should not be about affordability. And where there are structures already in place, it is all about the will changing something. And this is something where a change can be achieved in a very simple way. We just have to use what's there. And this is our goal and campaign.
Could you tell us?
Yeah, I would like to address the parents, because I've met a lot of parents of retinoblastoma children here in Nepal, and I would like them to know that the disease is curable and that they shouldn't, that they should really have their child treated and not go home in the villages and just let things happen.
Well, it was a pleasure talking to you, both of you. Thank you very much for coming to my show.
Thank you
very much for giving us
you.
that opportunity.
To your audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.